The New Anglia Local Enterprise Partnership LMI sessions. Today, I'm delighted to welcome Anna Huggins. Anna is a paediatric nurse by background and is actually now the project lead for the Norfolk Health and Care Academy. And Anna's here to speak with us today to talk about careers in healthcare. And the whole idea of the Health and Care Academy is actually to make young people aware of the 350 plus careers that are available in the Health and Care Service. So welcome, Anna.
Hello. Now, some of you, I feel like I'm going to bore the socks off because I know I've spoken to some of you individually. So, you'll just have to amuse yourself while I go through it all again. But I'll do a whistle stop tour. I work for the Norfolk and Norwich, but I'm funded through Health Education England. And the idea of my post and my role in the academy is to try and give young people an idea of some of the health and social care careers. I think there's a big gap of knowledge in terms of what is available within the health and social care setting. So we are one of the biggest employers in the county. And I think people have a misunderstanding sometimes or lack of understanding. And I think, I'm guilty of that as well, to know what is available and how can you choose what you want to do if you don't know what's available. So we're midway through our senior academy, which is running well, and we are learning all the time. There was no pattern to follow. There was nothing had been done like this before in terms of an entirely virtual program. So we grabbed it with both hands, and we are learning. We are aware that some sessions are better than others in terms of the content and how it's delivered. But what I will say is that Ryan and I, who oversee the program, we do bring a sort of a never-ending inquiry to our work in terms of really delving into what worked well and what didn't work so well, so that we can continue to try and improve. We're absolutely not there to just tick a box and say session delivered, there we go. We really want to inspire the young people, and part of that, I think, is giving them. We give them a booklet. It's a portfolio of learning. It's theirs to keep. We don't look at it, because what we want them to do is to record in there their thoughts and feelings about how they felt the session, what they learned from the session, and what they felt from the session. So it's meant to be very reflective in terms of what surprised them. Was there an element of that session that they really enjoyed? Do they want to look further into things that are patient facing, that are non-patient facing? And it can really help to drill down the bits that they did enjoy. So given that there's 350 plus careers in the NHS, we can't showcase them all. So for our junior academy, we're going to be running a week of sessions. So it'll be 5 days with a different profession on each day. Now, we'll try and give a broad overview and give a good skill mix across those 5 days. So there will be an allied health profession, and allied health professionals cover everything from OT, physio, speech and language, radiographers, operating department practitioners, and many more. So we'll have one of those. We'll also cover a very popular profession that is always that students are always keen to look into, which is it'll be either paediatrics, children's, or midwifery, or the ambulance service. So we're hoping to cover one of those in there so that we get one of the popular ones. We'll also cover an unregistered profession. So we'll cover something that is maybe a secretary, a medical secretary, or a ward clerk, or a porter, or IT, or medical engineering. So something that is a non-registered profession. We'll also have a miscellaneous day where we will probably show them a profession that they haven't come across before. And the last one will be It will be something from learning disability or mental health. So we will try and give a broad overview, and from that, even if we don't cover the profession that the young person is thinking they want to go into, we'll hopefully have started a little bit of an inquiry in their own minds as to what it's about to work in the NHS. And I think what's really surprised us for them in the senior academy is that they really like the idea and weren't aware of how easy it is that once you're in, to transfer around the health service, and that is for goes for social care as well. Once you're in, you can really start to get to grips with what it is you enjoy and go in the direction that you want to go. Whether that is up, sometimes for some people it is, but for a lot of people it's about going sideways into lots of specialities or going off into different roles. So certainly once you're in there, the training is available. We'll also cover within that week, we'll try and cover, get the career development team in to come and look at some apprenticeships or things to go on to once they do finish school, of different routes and different ways in, because I think that's always interesting. So I think it's really important. I think it's a great opportunity for young people. In some ways, I think it is better for the young person to be given a broader overview rather than necessarily drilling down into sometimes, unless a young person is absolutely, hell-bent on a certain career and that's where they want to go, and there's no, there's absolutely no room for manoeuvre there. I think it's quite important for young people to attend this because they get a better, broader overview of what the role involves and also how they link into other services. We're tending to find that following our sessions, if students really are interested in a certain profession they've seen, we're linking them up with the professional to be able to then hopefully at some point set up a direct face-to-face work experience. So that's the idea, and we do tend to get the right people in the right places because they've seen a bit about what it is to work in healthcare. They've then taken the initiative to ask myself for the contact details, and we then put the initiative onto the student with the support of the teacher or myself to set up that actual direct work experience. And if those that want to do that, they're the ones that we really want to get into placement. So that's the idea. Obviously, we're not on a known timescale at the moment with COVID and when it'll be safe to do so, but we're hoping it won't be too far away. In terms of how the junior academy is going to run, it will be it was designed to cover the full 5 days, and I know this is problematic for some schools because they don't want students to miss more studies, and I do get that, and obviously that's the school's individual decision. For those that do feel able to allow students to partake in this work experience, it will follow 5 days. As I said, with the different professions. Each day will start with approximately an hour, maybe just a little bit more, with the professional coming on to talk to the student about their role, career, and a day in the life of what their job looks like. That'll be through videos and hopefully be a little bit, it'll be quite engaging, but a little bit interactive. What we'll then do is we'll set the students a task. We'll ask them to, it won't be challenged, it won't be something that they won't know how to do or won't be able to do. That we really don't want that situation at all. So it will be something fairly straightforward. It might be creative, and it'll be certainly something that they can do individually and on their own without any assistance. It will be around the role that they've heard that morning. It would just be a little bit of them trying to find out the learning rather than having it fed to them. So it just enables them to look around. It might be that they write a job description, or it might be that they set out a meal plan, or they have to think about what a day for a person with a certain injury might look like and what the issues they might encompass. It could, there's a whole range of different things, but it will be something fairly, straightforward but informative and allowing them to find out a little bit more about the role. When they'll also be asked to, during that time, to think of a question that they'd like to ask the professional, and we'll ask them to submit those. Then when they come back in the afternoon, there'll be a token feedback from each person, so it won't be lengthy. It would just be fairly short, but we need to give them an opportunity to feedback something that they've learned during their task. And then they'll be given, then the Q&A will happen. And obviously questions can be read out anonymously, because I know how self-conscious students are in terms of asking questions in front of other people, particularly if they're with other schools and other students that they don't know. So the fact that they can submit the question earlier means that we'll read them all out anonymously and get them answered for them. So that is the day. It will be approximately the length of a school day. Obviously, there'll be lunch and breaks within that time. And given that we've got the 2 hour, it will be about 2 hours they'll be set the task for. They can have their lunch in there, obviously, whenever suits them. But we'll have an arranged time to come back online and to meet up. Now, we're going to be using Microsoft Teams as the platform to deliver this. And now some students will be working from home, and as such, we will be seeking GDPR permissions from your trusts. For those that are in schools, if teachers are happy to log on for the students in a room, they might only need one device that they can all sit around. Or if they're on individual devices, they can use their school logins. Again, I think if they're on individual devices that's not teacher login, I think I still need the GDPR permission. So unless it's teacher login, I think that's the case. So I will be seeking those. As for whether students work from home or the school, it's entirely up to you. There probably will be a certain amount of having to oversee a group of students if in school, if that is the case. But like I said, I wouldn't imagine that they'll need any assistance in terms of managing the task. So I think in a nutshell, that is the Health and Care Academy. I don't know if anyone's got any questions. The group size will be about 30, around 30 students. If you submit approximately 30 students from your school, they will all be together. If there is, I mean, some schools have just, I've said we're not really doing work experience, but we've got this one student who would really like to sign up for this, and I think it'll really benefit them. We'll absolutely take that one student. So there is no minimum and there's no maximum number. Some schools have asked us for quite bespoke experiences, because that is what they feel they can accommodate at the moment. So I know some schools have asked for an after school. Some schools have asked for just certain days of the week. What we'll do is there is a form that I've sent out a link for. Those that are doing the full 5 days, we've asked to fill in the form. The closing date for the forms is 30th of April. After that time, once we've got an idea of numbers and we've got an idea of how many speakers we've got and what capacity they have, we'll then be able to decide whether or not we'll be able to facilitate the bespoke arrangements. And if we can, we absolutely will. So if we can facilitate an after school, we will. And I know some of you have asked for just a 1 day. And again, we will support that as long as we have the capacity to do so. So I think the full 5 days, all the students that apply for that, we will look after, and we will accept on the programme. There isn't a case of turning candidates down, if you like. I feel if year 10s have got the desire to attend, we want to have them. However, yeah, the bespoke arrangements, they will be decided once the closing date has passed. I'll then come back to you. If you've come back to me and asked for something bespoke, I've not ignored, I have ignored you, but I haven't deliberately ignored you and forgotten about you. I will just be able to decide on those once I know what capacity we have left to fill them. So I hope that makes sense. I did just see a question in the text. Do you offer support for young people on traineeship and apprenticeship programs? I'm not entirely sure what you mean, Jackie, in terms of support. So you might have to explain that a bit more.
Jackie, would you like to come on board? I'm not sure if Jackie's with us still.
I don't know. Ah.
Okay, while we're waiting for Jackie, maybe if we could have a look at the next question. This
Yeah,
is from
sure.
Emma Durand. Is it
Is
strictly
it-
open to year 10s only, or could this year's 11s join? They would have left us by July and would be at home.
Okay, so Emma, I think we've had a conversation on Teams before, and I think your school works slightly differently, if I remember, in that your school years go up in the June, July. If that's the case, then yes. What I can't do is there is a program run by the career development team, who are an entirely different team. Oh, she's talking about current year 11s. Right, okay. I might have to come back to you on that, Emma, because like I said, there's a career development team that are offering a different work experience opportunity, although I don't think it's massively I can find out for you, Emma, and get back to you, because yeah, there is another program running for the year 11s from a different team, and I have to be a little bit careful that you know, I don't encroach on their service. So I will get back to you, Emma, about that. I will make a note. Is there anybody else who has any more questions? Yeah, okay. So yeah, Emma, you'd like to be directed to the career development. Absolutely. I will find out what they're running, and I will see if I can put you in touch with them for the year 11s. Christine Walton, is that for your year 11s too?
Yes, please.
Yes, please. Okay. Yeah, sure. They will have a long summer off. Yes, and that's something that we have considered. We have considered whether or not to run things over the summer holidays or after school or Saturdays. And I think I would be really interested in your feedback in terms of what the student appetite is, because I know some students feel that they just, you know, there's summer holidays, or they've got jobs, or they're going away with family, or they just want a break. So I don't know if there would be the interest over the summer. The same thing applies, I guess, for after school. Is there the appetite after school, or are students just exhausted and, you know, not ready, not able to absorb any more learning? And yeah, and Saturdays as well. I know the school week is very long, and to make it another day long is, you know, that feels like quite an ask. But however, I might be completely wrong. You all work with the students. So if you feel that there is an appetite for sessions to be held outside of school time, we can absolutely look into that. To be honest, it will be useful to note going forwards, because there's more ability for us to get students in outside of school times anyway. So summer holidays, after school, or Saturdays, because we're going forward, we're hoping to have a more of a blended learning experience where students will come in. We will be able to give them department tours, take them around the hospital, and again, that's always better at less busy times. And we will have access to some lovely big sort of lecture theatres or classrooms, again, when other students are not using them, which again is at the times when school holidays and those sorts of things. So if there is the appetite, certainly I think the NHS and social care is a 365-day-a-year service. So there's no reason why we can't deliver it. It just really is based on whether the students, you feel your students would want to do that. I worked with learners. So this currently is just for students in school. There are a number of programs, Jackie, for those in apprenticeships. I would look up Skills for Health. I think they're on most social media platforms and on the NNN site, where there's all sorts of traineeships and apprenticeship programs. So yeah, I would have a look at the skills for health look those people up. Emma feels that the summer holidays there would be, if it was flexible, as they missed out on their year 10 work experience and do have an appetite. Okay, so maybe we need to do a little bit of a scoping exercise in terms of trying to find out numbers and those sorts of things to see whether we could get a group together to do it over the summer holidays.
Yes, perhaps if people would like to, would it be helpful if they get in contact with you direct or with us in the team to actually?
Either would be fine, Madeline. I really don't mind. It's helpful, you know, I'm always happy to engage with people. I think it's the best way to get an idea. I deliver the academy, but I'm a nurse by background. I'm not a teacher. So I really want to work with people in terms of understanding their learners and understanding what is needed and what is wanted. So I really would love to work with you all. And so if we can engage and you can just let me know, then I'm happy to take that forwards.
Okay, that's brilliant. That's super. I'll, do you want to just drop your email address in the chat, and I'll also say as well, if people can either contact their enterprise coordinators or contact me direct, and I'll put my email address in there. That would be brilliant. Do we have any more questions for Anna?
I didn't clarify with you, Madeline, how long you wanted me to take before I started, and that's I wasn't sure how much information to share and whether I should be, you know, refining it down. I wasn't sure.
No, very flexible as well, as long as you and the guests are willing to stay would be the answer for that, if that's all right.
Okay.
So I think there's more messages coming through. Bear with me. Okay. Jackie's gotten us a thumbs up. That's great. Emma says, thanks, we'll be in touch and we'll discuss with our EC. I think she means Hannah College. Okay, that's great. Thank you.
Has someone got their hand up? Oh, Sophie's got her hand up.
Ooh.
I'm going to do a shameless plug. Is that allowed?
Yeah, of course you can.
Go for it.
So we were really disappointed that when you first launched this academy that we didn't have enough students of the older students to attend it, because we'd struggled to recruit for our A-level sciences previously. We didn't quite have the right caliber to do A-level chemistry and biology and things like that. So we didn't have the students that were after this particular thing. But we've changed our offering, as you know, Anna, but this is a wider shameless plug. We've changed our offering for sciences in sixth form at UTCM. We're still doing physics as we normally would do to support the engineering pathway. But we've been so excited about all the careers that are available, those 350, however many careers, that we have launched a new course for 2021 on health sciences, which is like an applied science course. And so we really, really hope we can take advantage of the in-person work experience over the next couple of years for those students that join us in sixth form. But I've just dropped an email to everybody with details of that course in case anyone's got any questions. And if they have, then they can let Christine Walton or I know about the UTCN offering, because it's exciting. There's no doubt with this many different careers that we should be offering more of this kind of course as a school that does more of the employer stuff. So thank you for your support. Shameless plug.
No, absolutely great.
No, I think that's been really important to, working with, colleagues like Sophie has been really important to the academy, and it can only benefit the students and the outcomes. So I think that is, that's a great way to work, if you ask me. But I feel that there is so many careers within the NHS that are not known about. And sometimes students think they know about a career, but don't really know the detail. And how can you make a decision, based on your life and choices, if you don't know what's available out there? So really we're just trying to open up the box a little bit and just try and show students a little bit more about what is available for them, because it really is a lifelong career, the NHS. You can move around in it to all sorts of different roles, and that's something that has really come through with a lot of our speakers, and students have been really interested to know and haven't understood before quite how much scope there is to move around and to change job roles and change careers completely within the NHS. So, you know, you can very easily go from working with adults to there's all sorts of different things you can do, from working in accident and emergency to working with people in intensive cares to going into organ donation to, you know, the list, I mean, is endless, and people tend to find their feet once they're in it and what they like and what they want to follow. So, and there's just so many, it would be impossible to cover them all, but to inform is what we're about, is to give that information and allow them to make informed choices. And I think even if they walk away going, do you know what, it's really not what I want to do, we've done our job, because, you know, better that they understand that about themselves than to walk into a career, get 18 months into a training program and decide that it's not for them. So we want to just put the students in touch with our professionals and give as much information as we can. Going forwards, we'd like to look at accreditation for our program so that they can have some accreditation, as well as we give them a certificate of attendance, provided they've attended the majority of the sessions and they've had a committed approach to the sessions. We give them a certificate of attendance, and they've got that to put on their CVs and when they're applying for jobs. So I think it's really important that they have this reflection. Is something that is taught quite widely within the NHS and social care, and it's something that I think is really important even outside of it, to have a level of self-reflection and understanding about yourself, your interests, your likes, to recognise your emotional reaction to something, I think is just really important, and that will only serve to help them in making their choices going forwards. So that for us is what we're about. We call it a program rather than a work experience, primarily for that reason, in terms of the fact we're not putting a student in a specific area to have a direct work experience, and that's why we call it a program, because it's much more of an overview of self-reflection and understanding of the roles and careers across the NHS and social care sectors. So I hope that's been helpful. If people do have any more questions, I'd be more than happy to answer them. I know it's been a bit of a whistle-stop tour. I think there's a lot to understand. We are trying to make sessions more engaging, more interactive. The more we go forwards, the more we learn, and again, working with yourselves is really helpful. I know Sophie is a great person that we're going to be using going forwards to develop, just looking at developing content and suggesting ideas of what works well. I think that's really helpful for us, because like I said, my background is nursing, and it's very easy for our professionals to slip into to PowerPoint mode if we don't absolutely insist on it not being. So Ryan and I try really hard to insist that PowerPoints are kept as far away from the academy as possible. So we are, we're going around, we're doing filming of different areas. We are capturing interviews with people. We're talking to other different professionals about their, what they can add. We're trying to find lots of different individuals to come and speak to us. They've all got so much enthusiasm and love and passion for their jobs, and that's what we want to get across.
That's brilliant. Thank you very much. That's really good. And certainly, having worked in the NHS myself as well, I would definitely say that there are incredible opportunities to move about and get additional training. So, and And when you think of all the different roles that are available, I mean, people don't even think about, medical illustration departments. And,
Yeah.
it's just massive. And of course, IT and all sorts of other things. There are, 350 different roles is it's quite amazing, isn't it? When you think about it, with lots and lots of opportunities. Sophie saying there, we can't wait to have some in-person opportunities. Is this likely to be in the next 6 months? I know it's hard to say at the moment. $1 million question.
$1 million question. I would say probably not in the next 6 months. And the reason I say that is timing as much as anything, because our senior academy finishes in July and the programme was set up to run virtually, so we will continue that. And the junior academy in July is also set up for virtual learning, and so we will continue that for this cohort of learners. Looking forwards to September, we're looking at a blended learning approach where a proportion of their time will be about coming to the hospital. I think what you gain with a virtual, what you lose with a virtual, you also gain. I think there are gains and losses with both. And I know for some people, it's not always easy to get to the hospital to attend 4 sessions. And so in some ways, this has been massively accessible for students to be able to log on. They might not have a parent who can drive them, from North Norfolk down to Norwich for the day, to spend the day and then come and pick them up again. So we're very aware of that. And that's something that, again, we will try and work with schools because what we don't want to do is only accommodate those that are, that have the parents that are able to drive them. We want to get to those learners that have difficulties, that may have not the best social setup, but really want to be part of this. So we want to overcome those hurdles and still get the learning out there. So there will be a proportion where they will attend the hospital. It probably won't be necessarily putting a student in a department for the day. What it will be going around departments, being shown how machinery works, being shown procedures, observing things in groups, I would imagine. And there'll also be classrooms for practical activities to take place, be that setting up a drip setting, or doing prescription checks of different drugs, or whether it's we can have fun playing around with plaster casts and putting plaster casts on each other. That's so there's lots of things that we can do in practical terms. But yes, I would envisage that the academy, and in the very essence of what it is, it will still remain that when students enter the hospital, it will still be on a group setting too, even if it'll probably be small groups. I can't imagine 30 students being sat around observing somebody having a procedure, a small procedure, but we can certainly do that in small groups, and that will be something that we'd like to be able to offer, so they can actually see things happening. But yes, that is the plan. But there will, I think, always be an element of virtual learning, because it really does offer an ability to be able to showcase many of the roles, and also hopefully what we're hoping to do is build our content resource so that we can allow you to access it in a time that is convenient for you as well, for your classroom. So if for your health and social care students, we can discuss and work out how that would work. But it would be nice if we were able to bend around you a little bit more, and give you opportunity to access materials at a time that fits in with your class and your teaching, and your students. So that would be the goal. And as we go through these sessions and through our programs, we are continuing to build content. So there is a model that's quite similar to that in Bedford that we're looking at, that we're hoping that we can sort of pinch some of their ideas, if you like, and take that forwards. to have a platform that you can access in your own time for your own classes. Having said that, I think to reach your Gatsby benchmarks, it's really important that we keep some interactivity with the professionals directly to allow them to ask questions and to allow them to engage. So there is a place for virtual learning, there is a place for recorded content, but none of these things will be in their entirety, so that we can ensure that the best experience is had across the board. It's going to be, eventually, I think it'll be cherry picking the best bits. And, you know, eventually we'll have, you know, an amazing program that will be, we'll have cherry picked all the best bits, and it will be recorded when it suits. It will be live when it's appropriate. It will be in the hospital when, you know, when the learning is at its best. So, yeah, it will be all of those things going forwards. But that won't be before September.
That's great. Very exciting stuff. Lots of happening in the future. And I think blended learning is generally going to be the way things are going to be for many organisations. And like you said, for the students who go through the academy, when they finish, if they're showing a particular interest in a particular role, you said that it'd be possible to link them up with a professional. And would that then mean that maybe that could lead to an opportunity?
Yeah. Yes, because experience. Absolutely. And that is something that we really want to encourage. You know, you're always surprised by actually when you start whittling down the numbers, the ones that actually, there's very few that actually want to, you know, on a specific profession. So, I mean, just to give you an example, we've had about 70 learners who went through a session, and I think there's 4 AHPs there. And by the time you take out the ones that are interested in allied health professionals, and then you take the ones that are still interested at the end of it, and then you take out the ones that, you know, that take the initiative when I've asked them to say, contact me if you'd like to be put in contact with a professional. And then you take out the ones that still follow up on that lead. And so by the time you get to the end point, it really is, there's actually the right ones, but there's small numbers, and but that's the right number, because those are the ones that really want to do it, and they're the ones that will, you know, that we want to get into those very limited work experience placements. So it's not just an easy option. I mean, it's fairly straightforward if that's what they want to do, but they do have to use their own initiative.
Absolutely, as they do in life. So
yes.
And obviously the programme offers a lot of generic skills that they can take with them through their careers anyway. So it's a really great opportunity.
Yeah, I mean, team working in the NHS is essential, and that's something we will be looking at skills, transferable skills that they can use across the board. So absolutely, when we're considering our tasks and things, they might be working in part of it in individually, but we'll have breakout rooms and things that we may use for if we're trying to get the right. They'll be quite considered, the tasks, and we'll try and get the most out of them.
Yes, and of course, communication skills are a big one. I remember from my time working with postgraduate medical education, the doctors. Yes, definitely the skill of communicating is really important in the NHS.
Yes, and I think that's something that can be nurtured and grown. I think you know, we don't want people to think that they, you know, because they might be a little bit shy, or because they're not particularly good at written skills, they might be dyslexic, or they might have other you know, learning issues. We want to embrace those students. We want to facilitate, we want to make their learning as good as possible. So we really want to embrace those students, and you know, they might be a little bit shy at the beginning, but we would hope that we will nurture them and encourage them, and that they will have an understanding about the role and an appetite for, and we want to grow that, you know, grow those young people and overcome some of those things. So that is, communication skills are huge within the NHS, but it is something that can be nurtured and something that can be grown.
Absolutely, yes. I remember lots of communication skills courses, and support. And it is a really inclusive environment as well, isn't it? I mean,
absolutely.
it's an absolute mix of all sorts of different people.
Yeah.
Absolutely great, because whoever you are, you'll fit in.
Absolutely. And we want to take away any shame or about any of the roles. You don't have to want to aim for the stars. And we had Serco come in to deliver our a session for the Senior Academy, and Serco in the hospital deal with everything from our waste management, cafes, portering, security, cleaning. You get out of those roles as much as you put in, and those roles are huge, and the hospital wouldn't work without them, and they are hugely valued within the teams and that they work in. The wards still see cleaners as part of their team.
Absolutely.
As a ward cleaner, you get a huge understanding of the importance of the infection control and how a ward operates. In some areas, it's seen appropriate that you engage with the patients, that you engage with the staff, that you get a feel for how a ward or department how they work and how they operate, and you can get a massive insight into health and social care through doing those roles. And they make the most wonderful nurses, or if that's the direction they want to go in, or care staff, because they have that understanding of a basic level, and from that grows some amazing professionals. So we would absolutely we understand and value all of the roles.
Absolutely. And having been in the hospital with a broken leg and having a most wonderful porter wheeling me around, absolutely, completely.
Yeah. It's so important, because you could be wheeling somebody to something that is to an operation that is life-changing. You could be wheeling somebody and at their most vulnerable state, and I think that is really important. And even in the cafes, the catering staff, it's about having a can-do approach. It is about saying, yes, of course I can make that patient with dementia a sausage at 2:00 in the morning, because that is absolutely paramount to what is important to them at that moment. And so by having that can-do attitude, you can feed a cancer patient at a time that is perhaps not canteen opening hours, but makes a difference to that person. You can make a difference to that family and the outcome for that person. It is all really, really important. So it's as much about even students that didn't want to necessarily work in catering or in portering, they still got a sense from our Serco manager of quite how important these roles are, and quite what a difference they can make to patient outcomes. So
absolutely. And also I can remember my director actually started off life as a porter. So if you choose, there's ways through and develop your career. So that's brilliant. Does anybody have any more questions? No, I think that looks like it. No hands up I can see. So that just leaves me to say thank you so much for coming today, Anna. I think it's been a really, really useful session. The Junior Academy and the Senior Academy is obviously a wonderful insight into the world of careers available in the NHS. So thank you so much for joining us.
No, you're very welcome. And please do get in touch with me if you have any questions, queries, want to know anything. Please do get in touch. We're happy to hear your ideas, share learning. Please don't, I want to engage with you all and work together. So that's where we're coming from.
That's brilliant. Thank you so much, Anna. Okay. And that's great. And I'll be in touch soon. So
okay, lovely.
That's super. Thank you. So I'll just say thank you, everybody, for joining today. Our next LMI CPD session is actually on the 13th of May, when we have Sarah Okatan again on the health and social care front. Sarah is actually from Norfolk and Suffolk Health and Social Care, and she'll be coming to speak about careers from their perspective. So hopefully you'll be able to join us then. So thank you, everybody, for joining today. Thank you so much.
Thank you. Bye-bye.